Courtney. I'm 37 years old. Have a bit of a belly, actually, pretty big belly. And I've been really looking forward to losing it. I've been overweight, I think, the past 6 or 7 years. And it seems just as after I hit 30, I got overweight. And before me, so I've tried working out, tried diet pills, and it's just been a real struggle. So I looked online, I looked under Liposculpture, and it seemed to have all the benefits that I wanted, and I'm really excited about it. I looked up Dr. West's reputation. It's great. Hey, how's it going?
Good to see you. Glad we're going to do this today.
Yes, I'm very excited.
Any questions?
Will there be any pain?
As we talked about before, there will be a little bit of a bee sting. The small areas that I have to put open the skin to sneak the cannula in.
Okay.
A little bit of bee sting above and below the belly button here out in the groin. But once that is done, that skin will be numb. What you'll feel is a little bit of pressure as I put in the tumescent fluid. But once everything's numbed up, then you shouldn't feel much at all.
Oh wow, okay.
You'll feel me kind of pushing and moving around, but that's not pain.
Yes, so when will I see results immediately after?
In the operating room, before things swell, yes, but the body starts to swell very, very quickly after this. So if by the time you get home and you want to look at things, it won't be anywhere near as thin as you thought it was going to be.
Yeah.
So you need to give me that 2 weeks or so for all the swelling and the bruising to clear up. And then starting about that 3rd or 4th week, now you go, hey, I like this.
Yeah.
But honestly, the real answer to your question is, you're not going to see an immediate result for probably about 2 weeks.
2 weeks, okay. Well, I think that's pretty much it. I'm really excited to do this.
Great. Well, you're a terrific candidate. I look forward to doing this. But time to take pictures and draw on you.
Okay, sounds good.
Now we're going to take... That's it. Working for me.
Thanks here.
All this is going to be gone. All this is going to be gone. Get this nice and flat. Whoop. Nice back in through there. Bring that down. Bring the hips down nice and narrow. All right.
I'm very excited.
Any questions?
I'm very excited.
We'll take good care of you.
Okay,
I'll see you in about 10 minutes.
Okay, great. Good deal.
Little needle stick here. Little one right here. One here. There and there. Deal? That's just the Novocaine. Didn't bug him at all. You okay? That should be the worst. That should be this nice yellow. This is where the medicine has started to set up and kick in. Nice and yellow. This is still red and very well vascularized. This is where the epinephrine hasn't started to work yet.
Because that's half shaved. So don't make me laugh. You might miss it.
So it's been an hour. We've got the tummy and the flanks all full of medicine and tumescent fluid, and you can tell by the blanching, all the nice white yellow skin that's left. There's hardly a few areas of red where the medicine hasn't quite kicked in, but we're all ready to go. How you feeling?
I'm feeling great.
Yeah, well, that's what we like to do.
Ready.
He's doing so well. Normally we start with a smaller cannula, but we're going to start with a little bit bigger one, see if he's numb enough, and we can work a little faster that way. It makes a little bit of noise.
Oh, it does.
Yeah, so this is
Okay.
that's part of it. Maria, can I talk to you in the... You can see how much thinner that's gotten, how much flatter it is on this side compared to this side. A little bit more to go here, and we'll move on. Right.
You're at 650.
650.
I feel fine. I feel absolutely fine. Yeah, I thought it was going to be more intense, or just like pain, but not that painful. But I feel no pain. Maybe I'll feel like a poke here and there, but that lasts for like a second. And considering what I'm getting, oh my gosh, it's totally worth it. So yeah, I'm very, very, very pleased with the experience.
Well, we're all done. Everything went very well. He lost almost 7 pounds of fat and fluid today, which some of that was the tumescent fluid we put in, so we'll have at least 5 pounds of weight loss from his liposuction. He tolerated very well. At the end, he got a little anxious to get off and get going, but finished up nicely. We're very happy. Couldn't be more pleased with the whole course of the case and the final result.
Hey, it's me, Courtney, in case you forgot. I just got out of surgery. I'm in really good spirits. I was awake during the whole procedure. I believe that they took a total of 7+ pounds out of my stomach area, flanks, love handles, and they showed me how much fat was taken out, and it was amazing. The staff, out of everything, was just incredible. The nurses held my hand, they smiled. Dr. West was great. You know, he was asking me questions during the whole thing, and it just went really, really well. The only pain that I experienced, if anything, was just like a little bee stings where they put the little lipo poles in me, and it was just smooth sailing throughout the whole thing. Again, the staff was great, and it all went smoothly. So I'm just waiting to see what the outcome is going to be. So I'm very excited, and I'm glad I did it.